Modern Dental Assisting Chapter 22 Regulatory and Advisory Agencies. In this lecture, we're going to discuss our regulatory and non-regulatory agencies, and we'll break them down a little bit and discuss what their job is. A regulatory agency issues laws and regulations that mandate compliance. Non-regulatory agencies are advisory and they issue recommendations. We also have our professional associations and organizations. These are a valuable resource. They help provide current infection control and other information. Many dental professionals choose to become members of their professional organizations. The ADA is a professional organization for dentists. They periodically update infection control recommendations as new scientific information becomes available. As a dental assistant, you can become a part of the American Dental Assistants Association, or the ADAA. This is the oldest and largest group that represents professional dental assistants. Members of the ADAA include the clinical personnel who work chairside with the dentist, and also the receptionist, office manager, anyone who's maybe working behind the scenes in the dental product sales, insurance, and then also in education. In Canada, they do have the Canadian Dental Assistants Association, and they operate under similar principles. Hygienists also have their place. They have the American Dental Hygienists Association. This is the national professional organization for hygienists, and they provide its members with professional support, educational programs, and opportunities to participate in the organization. So we can break it down further into state and local dental societies. They help you comply with the regulatory issues that are specific to your working area. So we have national, state, and local dental assisting societies, and they can answer questions and provide opportunities for continuing dental education. So next, we're going to talk about the Organization for Safety, Asepsis, and Prevention, or OSAP. This is a not-for-profit organization. It's composed of dentists, hygienists, assistants, representatives of the government, dental manufacturers, university professors, researchers, and then also consultants. It's an excellent resource for information on infection control, injury prevention, and also occupational health issues. Our government agencies consist of the Food and Drug Administration, Environmental Protection Agency, National Institutes of Health, National Institutes of Dental and Craniofacial Research, National Institute for Occupational Safety and Health, Public Health Agency of Canada, Center for Disease Control and Prevention, and then Occupational Safety and Health Administration. And we're going to break each of those down next. So first we have our Food and Drug Administration, or the FDA. This is a regulatory agency. It's part of the U.S. Department of Health and Human Services, and they regulate and manufacture the labeling of medical devices as well as antimicrobial hand washing products, and then our mouth rinses. Next, we'll talk about the EPA, or Environmental Protection Agency. They're a regulatory agency. They ensure the safety and effectiveness of disinfectants. They also regulate discharge and final treatment of waste materials like our chemicals, as well as medical waste after it leaves the dental office. The National Institutes of Health, the primary federal agency for conducting and supporting medical research. They translate research results into practice and communicates research findings to patients and their families, healthcare providers, and then also just the general public. The Institute of Dental and Craniofacial Research, their mission is to promote the general health of the American people by improving their oral, dental, and craniofacial health. Through research and training of the researchers, the National Institute of Dental and Craniofacial Research promotes health, prevents diseases and pathologic conditions, and develops new diagnostic and therapeutic techniques. Next, we have the National Institute for Occupational Safety and Health. Um, they do not have regulatory authority. They're responsible for conducting research and making recommendations for the prevention of work-related disease and injury. They make recommendations on information to prevent disease in the workplace, injury, and also disability. They provide training to professionals in the field of occupational safety and health. The Public Health Agency of Canada. This is the main Canadian federal agency that's responsible for public health. They support approximately 2,400 researchers and staff, as well as a wide variety of programs and services that are offered both by federal government and non-government agencies. The CDC is non-regulatory. Its role is to issue specific recommendations based on sound scientific evidence. Infection control procedures practiced in dentistry today are based on the guidelines for infection control in dental healthcare setting that is issued by the CDC. We have Occupational Safety and Health Administration, or OSHA. They are a regulatory agency that protects the workers against physical, chemical, and infectious hazards in the workplace. They establish protective standards, enforce those standards, and offer technical assistance and consultation programs. They are a federal agency, but 22 states administer their own state-operated OSHA programs. The most important infection control law in dentistry is the BBP, or the Bloodborne Pathogen Standard. This is designed to protect employees against occupational exposure to bloodborne pathogens such as hepatitis B, C, and HIV. Employers are required to protect their employees from exposure to blood and other potentially infectious materials in the workplace, and also provide proper care to employees if that exposure does happen. The BBP applies to any type of facility in which employees might be exposed to blood or body fluids. OSHA requires that a copy of the BBP be present in every dental office and clinic. OSHA Bloodborne Pathogen Standard Exposure Written Control Plan. This requires each office to have a exposure control plan, and it must clearly describe how the office complies with those BBP standards. The OSHA BBP standard requires employers to categorize tasks and procedures during which an employee might experience an exposure. With post-exposure management, we want to be sure that we have a written plan before an accident were to happen. This plan should explain exactly what steps the employee must follow after the exposure incident occurs and the type of medical follow-up that will be provided to the employee at no charge. The BBP standard requires the dentist employer to provide training in infection control procedures and safety issues to all personnel who may come in contact with blood, saliva, or contaminated instruments or surfaces. The employer must keep records of all these training sessions. The record must include the date of the session, the name of the presenter, the topic, and also all the employees who were in attendance. Hepatitis B immunization. OSHA requires the dentist to offer the hepatitis B virus vaccination series to all employees whose job does fall under category 1 and 2. Vaccines must be offered within 10 days of employment. The dentist or employer must obtain proof from the physician who administered the vaccination. Employees do have the right to refuse the HBV vaccine. However, if you do refuse, you should sign a informed refusal that would be kept in the office. Between 1 and 2 months after the series has been completed, a blood test should be performed to ensure that the individual has developed immunity. A physician should evaluate individuals who have not developed immunity to determine the need for an additional dose. Individuals who do not respond to the second 3-dose series of a vaccine should be consulted regarding their susceptibility to HPV infection, and then also take precautions. Employee medical records. So the dentist or employer must keep a confidential medical record for each employee. These records are confidential and they should be stored in a locked file. The employer must keep these records for the duration of this employment plus 30 years. OSHA Hazard Communication Program. The Hazard Communication Standard requires that employers inform employees about identity and hazards of all chemicals in the workplace that they could be exposed to. We have the revision that adopts the globally harmonized system of classification and labeling of chemicals, and it requires identification with uniform labels and SDS worldwide. We must identify by name all the employees exposed to dangerous chemicals, and we have to describe training, how we're using the chemicals and how they're handled, information about labeling and safety measures, and how to respond in a chemical emergency. Employee training. So this is required when a new employee is hired, when a new chemical product is introduced, and once a year for continuing employees. The dentist must provide the training, but may have help from the staff and dental assistants. And it must include how to safely use chemicals, understanding the SDS sheets, all safety practices and warnings, how to use required PPE in the office, and then safe handling and disposal of materials and chemicals.